51. Which of the following is called greenhouse gas? A. Carbon dioxide, B. Chlorine, C. Nitrogen, D. Oxygen. And the answer is number 52. Symptom of diabetic ketoacidosis. A. Diarrhea, B. Drowsiness, C. Dehydration, D. Paleness. And the answer is number 53. Which of the following is the common side effect of isoniazid? A. Diarrhea, B. Hypertrophy, C. Peripheral neuritis, D. Acute tuberous necrosis. And the answer is number 54. After the surgery of myelomeningocele, the baby is positioned in which of the following position? A. Supine, B. Prone, C. Sideline, D. Semi-floor. And the answer is number 55. According to Sustainable Development Goals, what is the target of neonatal mortality rate to achieve in 2030 by Nepal? A. 12 by 1000 live births, B. 16 by 1000 live births, C. 32 by 1000 live births, D. 24 by 1000 live births. And the answer is number 56. Which class of antibody crosses the human placenta? A. IgG, B. IgM, C. IgE, D. IgA. And the answer is number 57. Lesions begin as erythematous, maculous, and papillous that quickly develop into vesicles are particularly seen in A. Dermatitis, B. Eczema, C. Psoriasis, D. Herpes zoster. And the answer is question number 58. The primary purpose of regulating nursing practice is to protect A. People, B. Nurse, C. Employing agency, D. Government. And the answer is question number 59. Providing holistic and quality care on the basis of latest research and knowledge rather than traditional method is called A. Holistic practice, B. Naturalistic practice, C. Evidence-based practice, D. Normal practice. And the answer is question number 60. A nurse-based knows that the nursing care is effective through A. Doctor's feedback, B. Client feedback, C. Discharge instructions, D. Financial burden. And the answer is question number 61. The transfer of authority and responsibility for public functions and sharing of power between different levels of government is called A. Centralization, B. Power balance, C. Decentralization, D. Delegation of authority. And the answer is question number 62. An employee should receive orders from one supervisor only is the principle of management known as A. Scalar change, B. Centralization, C. Unity of direction, D. Unity of command. And the answer is question number 63. Act of issuing orders, assignments, instruction to accomplish organization goal and objective is A. Directing, B. Controlling, C. Managing, D. Organizing. And the answer is question number 64. Oral rehydration solution contains sodium chloride equals to A. 2.6 gram per liter, B. 1.5 gram per liter, C. 3.5 gram per liter, D. 5.0 gram per liter. And the answer is Number 65. Which position of the patient helps during nasogastric insertion? A. Prone, B. High floor, C. Lateral, D. Supine. And the answer is number 66. A patient with a cast in the left leg complains of that which indicates impaired circulation. A. Increased temperature, B. Foul smelling, drainage from cast, C. Decreased peripheral pulse, D. Irritability. And the answer is number 67. A female age of 30 years come to the OPD with the history of recent obstructed labor and complaint of urine incontinence from vagina. The cause may be A. Rectovaginal fistula, B. Vesicovaginal fistula, C. Stress, D. Infection of the uterus. And the answer is number 68. In which state of uterine prolapse? Cervix has prolapsed through the vaginal introitus with the fundus remaining within the pelvic proper. A. First degree, B. Second degree, C. Third degree, D. Fourth degree. And the answer is number 69. Which theory of pain asserts that non-painful input closes the nerve gates to painful input, which prevent pain sensation from traveling to the central nervous system? A. Pattern theory, B. Sensory interaction theory, C. Gate theory, D. Specificity theory. And the answer is question number 70. A patient in the second day of surgery complains of abdominal distension. What should or not advise for? A. Decrease intake of food, B. Ambulation, C. Provide a medication, D. Encourage to sleep. And the answer is question number 71. In which position should a woman be placed for perineal examination? A. Floor, B. Prone, C. Lateral, D. Dorsal recumbent. And the answer is question number 72. A pregnant woman is advised to avoid lying on back as it A. Reduce blood flow to the fetus, B. Increase blood flow to the fetus, C. Reduce sleeps, D. Reduce nutrition. And the answer is question number 73. A postnatal woman may experience postpartum blood during the first few days. What is the most common symptom? A. Tearfulness or crying, B. Excessive eating, C. Infection of the pelvis, D. Loss of insight. And the answer is number 74. What is the reason for encouraging ambulation during puerperium? A. Involution of uterus, B. Increased lactation, C. Decreased bleeding, D. Prevent infection. And the answer is 75. Osteoporosis in old women is due to deficiency of A. Vitamin A, B. Vitamin B, C. Vitamin C, D. Vitamin D. And the answer is number 76. Component of in-service education is A. Human research, B. Standard nursing practice, C. Staff development program, D. Cost of healthcare. And the answer is number 77. Which of the following skill is mostly needed for top level manager? A. Technical skill, B. Conception skill, C. Decision making skill, D. Interpersonal skill. And the answer is number 78. Injection are given subcutaneous with a longer needle at the angle of A. 15 degree, B. 30 degree, C. 45 degree, D. 90 degree. And the answer is 79. Which of the following is the first step of controlling? A. Determining deviation. B. Measuring performance. C. Establishing standard. D. Taking corrective measures. And the answer is question number 80. What should a nurse assess in a patient for most serious narcotic related side effect associated with epidural analgesia? A. Respiratory depression. B. Sleep pattern. C. Pain. D. Blood pressure. And the answer is question number 81. Which temporary structure of fetal circulation takes 1 year to complete? A. Foramen ovale. B. Ductus venosus. C. Ductus arteriosus. D. Umbilicus. And the answer is question number 82. Sign of respiratory distress in newborn is A. Bradycardia. B. Abdominal distension. C. Nasal flaring. D. Lethargy. And the answer is question number 83. A nurse uses a heating pad and forget to remove after a specified time and the patient get burned. It is an example of A. Negligence. B. Justice. C. Assault. D. Battery. And the answer is question number 84. A mother comes to know that child is mentally retarded but fails to accept. The patient is in A. Denial. B. Bargaining. C. Acceptance. D. Anger. And the answer is question number 85. Sign of Fidida mole is a gestational trophoblastic disease which is characterized by A. Hypothyroidism. B. Vaginal bleeding. C. Enlarged abdomen. D. Jaundice. And the answer is question number 86. During peritoneal dialysis, a patient complains of respiratory distress. What should a nurse do? A. Change position. B. Discontinue procedure. C. Decrease the rate of exchange. D. Give oxygen via nasal cannula. And the answer is number 87. Insulin is secreted by A. Pancreas. B. Liver. C. Intestine. D. Spleen. And the answer is number 88. A nurse must concern about the patient with severe depression for A. Suicidal ideation. B. Violent behavior. C. Talking less. D. Not taking food. And the answer is question number 89. Vitamin K is given to a newborn for A. Blood clotting. B. Prevent jaundice. C. Prevent infection. D. Maintain weight. And the answer is question number 90. A presumptive identification of unrecognized disease in an apparently healthy, asymptomatic population by means of tests, examination, or other procedure that can be applied rapidly and easily to the target population is called A. Diagnostics. B. Screening. C. Treatment. D. Surveillance. And the answer is question number 91. What is the nursing intervention in a pregnant after rupture of membrane? A. Monitor fetal heart sound. B. Monitor blood pressure. C. PV examination. D. Kept in left lateral position. And the answer is number 92. Which of the following is an important component during family planning counseling? A. Consent. B. Describe side effect. C. Maintain trust. D. Explain the benefits. And the answer is number 93. First nursing intervention in post-operative patient can be A. Assess the pain. B. Maintain airway. C. Identify surgical procedure performed. D. Provide oxygen. And the answer is number 94. How to prevent hypothermia in a newborn? A. Keep newborn in mother's chest. B. Provide heating pads. C. Breastfeeding. D. Providing oxygen. And the answer is Number 95. Where is popliteal pulse felt? A. Behind the knees. B. Behind the ankles. C. Behind the neck. D. Behind the wrist. And the answer is number 96. Planning, organizing, collaborating, directing are the function of A. Organization. B. Administration. C. Management. D. Leader. And the answer is number 97. Alter. Health maintenance is an example of A. Medical problem. B. Interdisciplinary problem. C. Nursing problem. D. Patient problem. And the answer is number 99. Which of the following exercise after knee injury is helpful? A. Aerobic. B. Isometric. C. Isokinetic. D. Isotonic. And the answer is number 99. Inspiration initiated by an intermittent negative pressure produced outside the thorax, resulting in the expansion of the lungs and drawing enough air. A. Positive pressure ventilation. B. Negative pressure ventilation. C. Patient initiated ventilation. D. Mixed ventilation. And the answer is number 100. Sciatic nerve originates from A. Lumbosacral plexus. B. Coccygeal plexus. C. Celiac plexus. D. Cervical plexus. And the answer is